First of all, Rachael Tomlinson, who's a disabled member of Disabled People Against Cuts, DPAC, active in the Labour Party and also working with Unite. And I hope Rachael will be talking about why we need radical change and what that will look like. So over to you, Rachael. Thank you.
Good evening. I feel very privileged to be invited to speak about the personal side of the things wrong with social care. I'm Rachael and I live with multiple sclerosis. I was a facilities manager in the NHS, therefore I am quite familiar with all the changes that have gone on over the last 12 years. I support the MS Society in a number of roles, including co-production and their Living Well programme. I'm also Regional Vice Chair for Unite Community, North Yorkshire and Humber. For 12 years, disabled people and people of low income have suffered cruel, disproportionate ostracisation and punishment simply for being who we are and simply for being how we were made, or simply for being who we became at a later point in life. This can happen to any of us at any point. It did me. We faced the greatest assault on our well-being in living memory over the last 2 years. Forced DNARs and large numbers died, not to mention those who were pushed back into social care untested. Many now are struggling to get the support to meet their needs, let alone any extras such as respite care, days out or medical appointments. Unlike medical care, social care has to be paid for, and how much is a postcode lottery and is decided per council area, depending on what funding is available. They can also take your income and benefits into account. My friend Susie lives with multiple chronic illnesses and requires care 3 times a day. This has recently been cut back from 15 hours to 10. This now means she can no longer access shopping, medical facilities and activities to continue a fulfilling life. She can't even get her hair washed in the time allocated. 3 in 10 of the 30 million disabled people in the UK live in poverty, which is directly affecting 3.8 million adults and 300,000 children. In addition to that, there are 3 million who are living in poverty, also live with someone who's disabled. This means that nearly half of 14 million people in poverty are affected by disability in some way or other. This leads to disabled people relying on family members and friends to provide their care. The current system is failing them as they have little respite care, support and are often financially drained. Those carers are currently saving this government £158 billion a year. Disabled people of all ages and older people are the most at risk group for being left on the floor, frozen or waiting for ambulances for up to 20 hours. With excess winter deaths this year set to break all previous records, it will be the most vulnerable who die. Indeed, I know a family who waited 28 hours for an ambulance for a child recently, and I've just pleaded with my elderly mother to increase her lifeline to include response, as she is struggling to get about, and I can't think of anything worse than being left on the floor for hours if she falls. Hospitals across the country are reporting weekly their no criteria to remain patients, which has been known to reach 200. And this means they're in a hospital bed when they could be in the community or in residential care. While this system is run for profit and not for patients, this situation can only get worse. 83% of adult social care services are run by the private sector, a large percentage of which are run by just 4 companies, and the number one provider valued at £1.2 billion in June this year when it returned to being a private company. What can we do? Well, you can join this campaign. Whilst the Labour Party conference passed a motion which included some of the demands of the End Social Care campaign, we are conscious we're still taking enormous efforts for them to deliver what their members so desperately need and want, and not to take the 3 parliaments to deliver, because many of us can't wait that long. They need to bring about a radical new change involving service users and carers and workers in the local community to co-produce and create a free at the point of use social care service which is publicly funded, publicly reimagined, offering choice, control and dignity for all, whilst ensuring obviously staff paying conditions reflect their skills and making it more appealing for others to want to join the service. Ultimately, we also need to make our communities more accessible and provide a welfare system fit for purpose. I will finish on this. It's now about survive or die. We absolutely must speak in those terms, lest we minimise the people who are at the bottom of this mess and what they are going through. In the meantime, please check on your friends, check on your neighbours, check on your family. Raise motions with your constituency Labour parties and unions, and write to your MPs and shout from the rooftops, end social care disgrace. Thank you for listening.